in the field of research. I bring here the evidence-based yoga therapy for PCOS. Means what are the research studies done in the field of yoga for PCOS? What is the safety and effectiveness found through those research studies? I'll be bringing out those concepts and the techniques which have been found to be useful. So let me first start with what is PCOS and PCOD. Basically, many people are confused about whether we should call it polycystic ovarian syndrome or should we be calling it polycystic ovarian disorder. Disorder is kind of the medical term used only for when there is a one imbalance or when there is one system of the body which is getting affected, while syndrome is the term used for when there is a multiple systems of the body getting affected, then we kind of call it a syndrome. So there is no harm in calling it PCOD, but more ideal term is to be using PCOS because it's a syndrome as it affects your gynec organs. It also falls under the category of endocrinopathy. That means it's affecting your hormones from top to bottom. And it also falls under the category of metabolic syndrome because it affects your metabolic rate, it leads to diabetes, insulin resistance, and in some cases hypertension. So that's why we kind of call it everything. But the more important thing to understand, as I have been studying about PCOS for almost since 2008, and that's when I had started doing research in the field. And I realized that the definition and the diagnostics have been evolving every few years. It keeps on changing because it's a new condition and we are still learning about how it affects the body, what could be the possible treatment available. But one important thing that we need to understand is how does the cyst formation happens, because that's there in the name of PCOS, polycystic ovarian syndrome, which means the presence of multiple cysts inside the ovaries. How does that happen? If you understand the normal menstrual cycle or how the eggs grow and mature inside of a system, you will realize that in a normal person, one of the egg gets selected and it goes through the growth and maturation, and then it undergoes ovulation at the time when it is getting released from the ovary into the fallopian tube for a possible pregnancy to take place. But in case of the woman who are suffering with PCOS, this egg selection happens and it undergoes half the growth, but before it is ready for ovulation, it turns into a cyst and it stays inside the ovary as a enlarged cyst inside the ovary. So the left side of the image is what an ultrasound shows a polycystic ovaries, where you are seeing multiple cysts sitting on the periphery of the ovary. So this is basically what the PCO looks like, polycystic ovary looks like. But PCOS comes along with the cyst in the ovaries. It comes with a lot of other clinical manifestation, means how it comes with other problems which the woman suffers. So the first sign of PCOS, when the woman actually realizes that there is some issue or there is some problem, is the menstrual irregularity. And that's when looking for a diagnosis starts. So oligomenorrhea, the delayed menstrual cycle or the absence of menstrual cycle. There are a lot of technical terms and definitions for each of these clinical symptoms. So like, what is the delayed menstrual cycle? So any menstrual cycle which is beyond 40 days, 40 or 45 days length is called delayed menstrual cycle. Any person who is having menstrual cycle where they are not having menstrual cycle for 3 to 6 months is called the absence of menstrual cycle. Okay, so anybody who is having these symptoms, especially the younger teenage girls, they need to go for a diagnosis of what is the issue behind having a delayed menstrual cycle. Then the second common things we see is acne and hirsutism, which is what actually bothers people more than irregular menstrual cycle. So the presence of acne on the face and even on the body, on the lumbar, on the back, everywhere. And the presence of hirsutism, which is excess facial hairs, the growth of hairs on the face, on the body, like a male pattern body hair growth. And similarly, the third is alopecia, which is the balding, the central balding. This is again like a male pattern balding. Alopecia, these all is happening because of the high testosterone levels, which is the male hormones. So it creates acne, it creates hirsutism, it creates alopecia. The central obesity, one of the commonest form of PCOS, where the PCOS woman is having too much of body weight, and most of it is around the waist and the hip region. It brings other complication. It brings the metabolic syndrome part of PCOS. So the diabetes, the hypertension, the cholesterol issues and all comes along with the central obesity. And then the acanthosis nigricans, which is the last one, which comes with the insulin resistance. Whenever the person is having insulin complications or problems or diabetes, long-term issues, it starts creating the dark patches in the crevices of the body, like the neck, armpit, and groins areas and all. So these are some of the common clinical symptoms or manifestations of PCOS, which we can see in the person and try to take a guess that they might be having a PCOS. But it doesn't mean that all of them necessarily not going to be there with everybody. We have seen cases where we see underweight PCOS girls. So they don't need to be necessarily obese. They don't need to be necessarily having diabetes, insulin resistance, or all the issues. Some of these forms may be present. What is more bothering than the clinical symptoms is the long-term complications of PCOS. So let me give you an example, a case study of how PCOS affects. A teenage girl, a college-going girl might be having irregular menstrual cycles, and I have seen cases where they are really not having menstrual cycles every month. It's delayed, and it comes once in 2 months, once in 3 months, once in 6 months. And when asked that why haven't you gone and get it checked and find out the reason behind it, there was a very naive answer from a teenage girl that it's convenient. Why do I have to do anything? But at teenage, it's a new issue. It's a new problem to your body, and it may not look really big. But the years that passes by, it keeps on getting complicated. It keeps on growing into a bigger and bigger problem. So we end up seeing teenage girls with irregular menstrual cycle and maybe some acne and hirsutism. But by the time they reach adulthood, at the age of 28, 30 years or 32 years, then they are struggling with the infertility. That's when actually the diagnosis of PCOS starts, because difficulty in conception leads to running to the hospitals and getting it checked and looking for the treatment. So almost 75% of the PCOS women suffer with infertility, and even if they conceive, 33% of them end up with the miscarriages in the first trimester. These are the statistics, global statistics available. almost 50% of the PCOS women develop type 2 diabetes by the time they reach 40 years of age. So the number of years are passing by, the complications keeps on increasing. Up to 26% of them have a risk of developing heart attack if it is not being taken care of. Almost 50 to 70% of the PCOS women develop insulin resistance as the disease keeps on growing. So these are different numbers, different percentages which are available. But what affects almost all of them is the body image anxiety, the difficulty in weight loss, the difficulty to deal with acne, hirsutism, the excess facial hairs, body hairs, the mood fluctuations. A lot of PCOS women suffer with depression and feeling low on a monthly cyclic way. A lot of social dysfunctions because of unpredictability of the cycles, unpredictability of the mood fluctuations. There's a lot of social dysfunction associated with PCOS. Now, coming to the risk factor, why does it happen? Who are at the risk of developing PCOS? So yes, there are some genetic inheritance. If the mother is PCOS, sister is PCOS, the chances are that this girl is also going to develop PCOS. There's a higher chance. We also are seeing that diabetes is one more connection which lead to genetic inheritance of PCOS. But everybody, whoever has developed, who has genetic inheritance, your genes gets triggered only by a wrong lifestyle. And what does that include? It includes sedentary lifestyle, which means I'm not exercising. I don't have much of a physical activity. The typical example of it is desk job. I have 10 hours, 12 hours of desk job. And apart from that, I don't find time to do any sort of exercise. So neither my job is making me move, or I don't find time to move otherwise also. The wrong diet. So if your hormones, if making your moods to fluctuate, it leads to binge eating or sweet craving, which is commonly known with the hormonal imbalances. And a lot of wrong diet, junk diet, sweet tooth, and all leads to weight gain and then difficulty in weight loss. But I would like to emphasize on the third component of lifestyle, which is stress, which actually can be the trigger for all of this development. So where it starts from the mind and it percolates down to your body. I'll explain how, but let me just touch upon the treatment available. So there is pharma treatments, medicines which are available. It starts from oral contraceptive pills and it goes to some hormonal supplements. And the last treatment which is available in drug therapy is metformin, which is the type 2 diabetes drug. But we are seeing that it still doesn't solve the problem. A lot of people with metformin suffers with more side effects of taking the tablet than the side effects of having the PCOS. Then a lot of research has been done in the field of diet, where it has been shown that PCOS women should stick to weight loss, low carbohydrate diets. And a lot of studies has been done in the field of exercise also, finding out which form of exercise would be more ideal, which form of exercise would lead to the weight loss. Some of the studies have found positive results, but a lot of them have been still struggling and looking for answers. And that answers lies in the holistic approach to yoga therapy. So when I say holistic, means it should include every part. It should solve the problem. It should go to the cause of the problem and not try to manage the symptoms or suppress your symptoms by taking any drug or pill. So let me first explain to you the basis of this therapy. So the basis of yoga therapy is coming from an Upanishad, Taittiriya Upanishad, which explains that a human being is consisting of 5 layers of existence, 5 layers of their individuality. Now, what is those 5 layers? So the first layer is your physical body, the Annamaya Kosha, your physical existence, which where the holistic yoga therapy will treat by giving asanas, by giving physical movements. So there will be asanas which will specifically focus on the pelvic organs, improving the blood circulation to the uterus and ovaries. The better the blood circulation, the better the oxygen supply to the body, the better chances that the organs are going to function at their optimum level. Okay, so we know that the lifestyle which we are living, where we are sitting on a chair most of the hours and we don't have much of a movement or walking and all. So there is a reduced blood circulation to these pelvic organs. And by doing certain poses like Baddha Konasana, Malasana, Vishkonasana, we can very easily improve the circulation to these parts. Then the second layer of existence, according to the 5 layers, is the Pranamaya Kosha, which is our vital sheath, which is our prana, the life force which is running inside our system. And we know it is our breath. Breath is what keeps us alive. So we have a lot of studies done in the field of yoga proving that breathing exercises, pranayamas can help detox your system and can reduce the stress immediately. Okay, the sigh of relief. Why do we call it a sigh of relief? As soon as you take a deep inhalation and exhale deeply, your body feels calmer and relaxed. So we need to remind ourselves, we need to train ourselves to keep breathing through that pattern constantly. 70% of the toxins are released simply practicing deep yogic breathing, like in one of the technique called sectional breathing practices. Okay, so we have specific practices which can reduce your blood pressure, which can reduce the stress effect on the body, which can calm down the mind and help circulate better circulation in the body. Then the third kosha is Manomaya kosha. The third layer of existence is your emotional sheath. Means my likings, my dislikings, my preferences, my emotions, my feeling happy about something, my feeling low about something. That is very particular to me. That is very individual to me. That makes me who I am. So but this is the area where the problems start. If we look at all the situations which are stressing us around us, this is the kosha where the problem starts, because we tend to perceive the situations differently. We tend to have a different like and dislike for the same object or for the same situation, which leads to the chain of thoughts, the speed and the emotions connected to it, and finally develop the full stress physiology where I'm hyper, I'm agitated, I'm irritated, I get angry, I get headaches and all those symptoms. Whenever we are under stress, our body produces a hormone called cortisol, which is the stress hormone. And whenever, like, I'll give you an example, when we are in an accident and we are like in a road accident, God forbid ever, but let's say if I'm in a road accident, my body is supposed to react to that situation and help me cope up with that situation. So my body is supposed to release cortisol, my body is supposed to have a stress response, my pupils need to dilate, my heartbeat need to increase, my breath need to go faster and all of that. And it helps me for that moment, and it's good at that moment. then my body has a stress physiology. But if I'm chronically having that stress response, means I'm supposed to have that stress reaction at that moment, and I'm supposed to come back from that to a relaxed state. But if I forget that, if I'm not able to come back to that relaxed state, and constantly staying into that stressed, heightened level, and that then it starts affecting my memory, then it starts affecting my immune system. I fall sick very easily, my immune system gets weak, I start developing a foggy memory, I don't remember things easily, and all that starts to happen when we are chronically stressed, when we are everyday stressed, and we are most of the time I'm awake, I'm stressed for small things, for which are not going away, when there is no break and no relaxed period in between. So this is very unhealthy, and that is the reason for so many people developing these psychosomatic disorders, so many people developing these lifestyle disorders is because of this, the chronic stress which we are not able to come back from, where we are not able to have a switch off button. And it also leads to the food seeking behavior, which drives you to eat when you are upset, when you are angry, when you are depressed, and lead to wrong eating habits. And this all will add to your cortisol levels, and you will develop the conditions like diabetes, insulin resistance, and hypertension. The fourth layer of our existence is Vijnanamaya Kosha, which is the intellectual sheath, which is very high in people in today's era, because we won't accept anything until unless I'm given an explanation, until unless I'm given a justification, until unless I'm given a theory behind it, how it works, why I should do it, why I should change, and all of that. So it's a very important kosha of our existence today, and that is the reason why we are having this program today, is Vijnanamaya Kosha, to satisfy my intellect about the benefits and safety of a particular therapy. And that's when I would be able to convince myself to make changes in my lifestyle and adopt a different lifestyle than what I am used to, so that I can see the changes, so that I can see the benefits. It includes notion corrections, strong opinions about good or bad, or what I know as good or bad. Might not be right, and I might need to see things differently. I might need to change things, and that's where the therapy includes the lectures, the seminars, or the personal counselings to correct those notions, to change, to give explanations for what is wrong, what is right, what you need to change. And all of this exercise, from your asana, from your pranayama, breathing exercise, satisfying your intellect, leads to the final layer of existence, which is the Anandamaya Kosha, which is my bliss sheath. So one study found that a consistent yoga practice reduces your depression and lead to a significant increase in your serotonin levels. Serotonin is the hormone which we call as feel happy hormone. Like cortisol is the stress hormone, the serotonin is what makes you feel happy, what makes you feel blissful and enjoy things. And it helps in reducing your cortisol levels. As serotonin level keeps on increasing, your cortisol levels will keep on reducing. At the University of Wisconsin, one of the researchers found that the left prefrontal cortex increases the activity in long-term meditators, or the people who are regularly practicing yoga, which helps in improving your happiness, which helps in improving your immune functions. So just why we all have been seeing so many people all over the world has been adopting to yoga. The whole world is talking about yoga and practice of yoga, and it is what is going to help people. It is reaching the schools, it's reaching the colleges, it is reaching the hospitals, it's reaching everywhere. Why so? Because there has been so much research done in the field proving its effectiveness, proving that people require this. People require to calm down. People require a better immunity. People require to feel happy. And that will make your health functions improve. That will reverse medical conditions like PCOS. Okay, so this is where I will end, and I will hand over to Charu. And whatever doubts and questions you are having here, I will take at the end of the session after Charu finishes her portion.
Thank you so much, Nidhi.
Nidhi,
Nidhi, can I share?
you need to
Yeah.
stop sharing so that now.
Yeah, just a second. Okay, is my screen visible?
Yes, it is visible.
Okay, so very good evening to everybody, and thank you, Nidhi. And Nidhi has very beautifully summarized and given us a very comprehensive introduction on what actually PCOS is. And I'm sure a lot of people who have joined in the session today are very familiar already with this term and are somewhere, struggling with it or are dealing, different ways of managing this situation. So I hope in the next 15 minutes I'll be able to give you a few like a teaser kind of a thing in what we will do in our next 3 days of the upcoming detailed workshop that we have planned for you guys. So yeah, any questions you have, you can keep writing in the chat box and we'll take them later on. So like Nidhi has very nicely explained that, what PCOS is and how it happens. I would also like to start from there. I will not take much time on this. So whenever a patient comes to me with a condition of PCOS, I take 5 minutes, to help the person realize that how did they land in this situation? What actually caused PCOS in their normal lives? They were not born with it. Something somewhere went wrong, and this, they landed in this situation of PCOS. So, like she said, there is definitely a role of genes, but then there is a bigger role of your lifestyle that leads to this lifestyle related disease of polycystic ovary syndrome. So, it is generally women in, from class 10th to the early years of pregnancy that you see that most women struggle with this disease. And the factors that I've written on the screen are, one out of these factors you will definitely find in your lifestyle that actually led to this problem. So things like long sitting hours, this starts when you're in the 11th or 12th grade, you're preparing for your entrance examinations, competitive exams, you're sitting for very long hours at a stretch, you're studying for very long hours. Or women who are into corporate jobs, they're sitting for very long hours. Then when girls move out of their homes, they shift to hostels or PGs for jobs, they're eating out a lot, they're ordering a lot of food from outside. Or women who are working mothers, or working women, they have to skip meals in the morning sometimes because of lack of time, traveling, then too much tea, coffee, alcohol, smoking. These are some of the common factors which are which we have accepted as part of our modern day lifestyle that actually lead us to the situation of PCOS. And all these you of course know that are directly linked to weight gain. And once weight gain happens, women get stuck into this vicious cycle of weight gain and PCOS. So just give me 5 minutes to explain this cycle in a very simple language to you. So like you see, weight gain is just the beginning. Once you start gaining weight, especially around your abdomen, जब पेट के चारों तरफ थोड़ा सा वजन बढ़ना शुरू होता है, then a new phenomena starts in your body which is called insulin resistance. You must have heard this term many times by your doctor or when you're reading about PCOS. PCOS, the biggest reason is insulin resistance. So what happens? Insulin is a hormone in your body, and because of weight gain around your abdomen, this hormone becomes resistant. It now does not function very well in your body. It's not that the body is not making the hormone. The body is very well making the hormone, but it's not working in its full capacity. And when the insulin is not working in its full capacity, body is making more insulin to compensate. So as a result, what happens? There is a lot of insulin in your body. There is increased insulin. Then because of this increased insulin, the next step happens that there is a decrease in a protein in the body which is called SHBG. Excuse me. So SHBG is a protein that carries your testosterone hormone in the body. Testosterone is a male hormone, but it's made in all female bodies also. And this protein called the SHBG is responsible for carrying this male hormone in the female body. So when this hormone is decreased, we have less carrier for the testosterone hormone in our body. So testosterone is freely roaming in our body because there is no carrier. And I'm sure you all know that your doctors get you tested for serum testosterone for your diagnosis of PCOD. This is what they want to check in your body, how much free testosterone is moving around in your blood. So when there is extra testosterone in your blood, it leads to a lot of male features in your body, like hirsutism. There is unwanted growth of hair on your face, on your body. Then there are problems with your menstrual cycle, and ultimately all this leads to infertility. And this increased testosterone again leads to more weight gain on your stomach area. So you see what's happening here. Weight gain की वजह से PCOS हो रहा है या PCOS की वजह से weight gain हो रहा है. It's a vicious cycle. And all women who come for a diet consultation in PCOS are stuck with this, that हमारा weight नहीं कम हो रहा है क्योंकि हमें PCOS है. Whereas this is the other way around. आपको PCOS है क्योंकि आपका weight ज़्यादा है. So this is just like the egg and the chicken controversy, and it's a vicious cycle that women struggle all their life but are not able to break. So you have to understand what leads to what here. The next biggest problem with the people who have PCOS is cravings, sugar cravings. This again happens because of this only issue of insulin resistance in PCOS. The insulin and blood glucose fluctuation is very common in patients who have PCOS. There are spikes, then there are downfalls in insulin and blood glucose. And because of this fluctuation, there is a complete haywire in the mechanism of appetite and satiety. So women with PCOS, young girls with PCOS often struggle with their satiety and their hunger cravings. They will often complain of feeling like having something meetha after lunch, something meetha after dinner. So this is also known as reactive hypoglycemia that occurs in most of the patients who have PCOS. And like you can see in this figure, this is a cartoon here, but this happens in real life. People who have PCOS have such strong sugar cravings that they cannot stop themselves when they see something sweet in front of them, because sometimes these cravings are so strong. And once they eat it, then there is a guilt associated. They keep feeling guilty that we should not have had it, and then this guilt cycle goes on. So cravings and appetite is a very big issue with women who have PCOS. And then comes this common point of discussion, which is the weight. you know a lot of women with PCOS, their life revolves around ways to lose weight. So, as this is an introductory session, we are not going into too much detail, but I would just like to say that, we don't have to let the weighing scale rule our life. Definitely, the treatment for PCOS is to lose weight, but that's not the only thing. You have to make the right effort towards eating the right diet, towards doing the right exercise, improving your overall lifestyle, and weight loss will automatically happen as a side result. Do not focus on weight loss, focus on the right lifestyle. Weight loss will definitely happen. There is no way that you're doing everything right and still your weight will not go. So that's the first thing that I start with, that maybe just remove that weighing scale from your room. Weighing yourself once a week is fine, but weighing yourself 3 times a day, before meals, after meals, just creates more stress. And like Nidhi has already explained, stress is doing no good to people who are already suffering from PCOS. So yeah, some points here. Improved abdominal obesity and insulin sensitivity is possible without an overall change in body weight. So yes, there is no need to fuss so much about weight. you can improve your insulin resistance, you can lose some inches around your waist, and that is enough for you to improve your PCOS, even if there is no change on the weighing scale. A lot of women, when they do a lifestyle change, they start feeling better symptomatically, their reports become better, their symptoms get better, but there is no change on the scale. So what happens here is, with regular exercise and balanced diet, you increase your muscle mass, you increase your lean body mass, you lose some fat from the body. So as a result, your overall weight remains the same, but PCOS symptoms get better. And that's exactly what the goal of the treatment should be, rather than putting all our energy into losing weight. So increased lean body mass also improves hormonal and metabolic parameters. And you must know that a lot of thin girls, thin women also suffer from PCOS. So weight is not the issue. It is the hormonal imbalance that's happened in the body that is the bigger issue. And if you take care of that, weight loss will automatically happen. So the treatment of PCOS is like a big puzzle. And like, if you miss one piece of a puzzle, the puzzle will never be complete. And most of the patients who come to me are often focusing on just one piece of the puzzle. It may be nutrition, it may be exercise, it may be just taking pills from the doctor, but they often forget the bigger picture. So at Wellcure, we are trying to help you get a holistic view to this problem and get rid of it once and for all. So the four major components of solving this PCOS puzzle would be diet first, then yoga, exercise, and physical activity, which is very important. Then keeping yourself extremely calm and your mental well-being, which is also associated to your sleep, is a very important factor. And last would come the drug therapy, wherein you're taking all kind of the pills that your doctor is prescribing, which is also very important. So each piece of this puzzle has its own importance, and we cannot overlook any of this. So as a dietitian, I'm going to focus on only the nutrition part of it. So let me tell you the role of a dietitian in this whole PCOS program. It is not just handing out a piece of diet chart to you that you will follow and things will automatically fall into place. It's much, much beyond that. And not a single diet helps everybody. There's a lot of customization and individualization is needed when it comes to diets for PCOS. So, a dietitian begins with first assessing your diet quality and your diet quantity. What are you eating? Where are your daily calories coming from? Then the next step is to assess your body composition. What is your fat percentage? What is the muscle percentage in your body? What's your waist circumference, hip circumference like? Is your weight good enough for your height? Not good enough for your height? Then we understand your reports, your all your medical tests, then your socio-demographic profile, then your culture, your religion, your profession, your sleeping, waking habits, everything has to be taken into care while planning and customizing a diet plan for you. Then the next step comes as a role of a dietitian is to educate you on various dietary components that can actually worsen your situation or they can improve your situation also. So diet education and nutrition education plays a major role here. And then the last is to help you with this whole journey of weight loss, because weight loss journey is not easy. It's not it's not it's not like maths that you will lose 1 kg every month or 2 kgs every month. Sometimes you lose, sometimes you don't lose. There are a lot of obstacles in the journey. You face some weight loss plateaus. So a dietitian comes in there to help you with this whole making the journey easy for you. So I'm going to just give you a few easy tips today, which which are applicable to anyone and everyone who has PCOS. The first is to think beyond calories. Stop charting your calories. If you're a PCOS patient, I've seen many girls who are stuck with how many calories does this contain. They will read the label, they will not eat it because it has a certain number of calories. Calorie counting is good, but not after a certain extent. You have to also make sure that calorie diet, suppose you're just eating 1000 calories in the whole day, you might also see the source of that 1000 calories from where it is coming from. अगर दिन में 1000 कैलोरी सिर्फ चीनी से या सिर्फ मैदा से आ रही हैं, then however few calories you eat, it's not going to help you at all. So focus should be there on a diet quality and also on the diet quantity if you're actually trying to get rid of insulin resistance and your PCOS symptoms. So the picture here is self-explanatory. Given a choice, will you choose an apple or a donut for your snack? This itself tells you the whole concept of diet quality. Then the next we come to is a lot of women make complete enemies of carbohydrates in their diet. And so much on the internet is promoting low carb, very low carb, or rather no carb diets for PCOS, ketogenic diets for PCOS. I would say that these are harming people in innumerable ways. So please do not consider carbohydrates to be your enemies. You need to cut them down a little bit, limit their intake, or maybe choose the right kind of carbohydrates in your diet. But there is no research, no doctor, no dietitian with the right credentials will ever tell you to completely stop carbohydrates from your diet. Carbohydrates, they have their own benefits in their body. They're the best source of energy that you can give to your body, and once you stop them completely, you will see the side effects of doing that in your body. So choose the right carbohydrates, choose the unprocessed, low glycemic index carbohydrates. I would definitely say to cut down on burgers and pizzas and junk food and cut down on the processed carbohydrates, but definitely choose the low glycemic index whole grains that are going to help you with your PCOS condition. Then this is the third tip, which is to avoid packaged, reheated, or low-fat, fat-free products. Most of this product coming in the market, they are packaged in a way that consumers are lured into buying them. They make you feel that they're selling you something which is very healthy, but it is all a marketing propaganda. Most of these products are unhealthy. They're just labeled in a manner that the consumers are completely confused. If they're calling a product low fat, the full fat version of it might just have 1 gram extra fat. If full fat ice cream has 20 grams of fat, they will make it 19 gram and label it as low fat. They're not technically wrong, but you will feel that let's buy low fat ice cream and have it. So there are various ways. They will put cholesterol free on a label which is plant based. Plant based foods can never have cholesterol, but they will fool you in a manner that you will believe you're buying the right products, and they're harming you in many ways. So first thing to deal with PCOS is to try and stop as many packaged and reheated products because they're completely lack of nutrients. Next is to really enrich your diet with microminerals. To all of those who go to doctors for the treatment for PCOS, you might be knowing that doctors suggest a lot of multivitamins and multimineral pills in your treatment of PCOS. So you understand the importance of having these minerals, and what better source can be than food. So it's always better that you include a lot of nuts, fruits, raw fruits and vegetables and salads in your diet to make your diet extremely rich with minerals and nutrients, rather than depending on a lot of pills. And these micronutrients, you need them in very small quantities in your body, but they have an immense role in controlling your mood swings, your cramps, hunger cravings, and all kind of PCOS related symptoms. You will see a lot of difference once you enrich your diet with these minerals. And the last and the most important point I would like to discuss is the importance of a routine in the life of a PCOS patient, or rather in anybody's life for a healthy life. If you have no routine, you sleep whenever you want, you wake up whenever you want, you have meals sometimes, you skip meals sometimes, some days you exercise, some days you don't exercise, this kind of a routine really confuses your body as to what this person actually wants. The body is actually confused. So if you have fixed meal times, fixed exercise times, and if more or less fixed sleep cycle, then your lot of your hormones naturally come into balance. So do not underestimate the power of a good routine. So try and at least during the weekdays stick to a fixed routine, and on the weekend, if it's just sometimes it's up and down, it's okay. But at least for 5 out of 7 days in the week, try to stick to a routine, and then you see the magic it does to your body. So these are some very simple tips that apply to anyone and everyone who's trying to improve their lifestyle and especially dealing with PCOS. And for more depth, in-depth information, coming with a 3-day workshop where we're going to discuss different strategies to deal with PCOS. I'm going to talk about various diet-related fads, questions like the use of dairy, the use of gluten in PCOS. I'm going to introduce you the concept of seed cycling, which is really upcoming and benefiting a lot of people with PCOS. And I'm also going to help you to design a typical anti-inflammatory Indian diet for PCOS. We will give you a few tips which will help you design your own diet for PCOS. So yeah, that's all from my side, and now I'll call over Ankur to take you forward with the session.
Thanks, Charu, and thanks,
Yeah,
Nidhi.
thank you so much.
I think your inputs on not only giving a much deeper understanding, which we as a common person we don't get, and we it's good to obviously seek guidance from doctors, but they also don't have that much time to devote to each and individual, and they do straight away prescribe medication or any diagnostic tests which are required. And also we've found that in case of doctors, unfortunately, their education is not in nutrition. It is more in anatomy, physiology, the medical procedures, or medication. But the a, a detailed knowledge on the nutrition is very very less. So same with the yoga therapy aspects. And as Charu shared, that the jigsaw puzzle will only get completed when we are working in all the four dimensions, and two dimensions are getting covered through yoga, the physical movement, the other aspects of it, the breath, as well as the sleep and mental well-being. And the nutrition aspect is gets covered through what Charu would be covering. So coming to the program, in the meanwhile, please any questions, please type in the chat. The program details are, first we'll be having two live yoga sessions. First one will be on 18th, where Nidhi would be setting up the base, on the day, one, about the entire PCOS, the specific, practices, why they work, and how, they're each and every, the protocols and other aspects. And then the third day, which will be a Sunday, where she will do the practical demonstration, and then she'll work with you on what she has shared on the day one. So that's how the structure will be there on the yoga sessions part. And the best part would be that these sessions, even if you're attending one of sessions, you should be able to continue for on your own. And it'll and we'll also be covering, giving you the recordings of these sessions, and also the audio downloads of some of the therapeutic practices. On the day two, Charu would be covering the nutrition aspect. She has already spoken about it, that she'll in detail tell about what would be the basic diet plan, how you can work in the limitations we have with the Indian diets, availability, and other factors. So that will be working. And we'll also be giving you a healthy nutritious book, where you'll get recipes which are not only easy, tasty, but they are giving right nutrition, which is very very essential. So you'll have more than 50 recipes of all the types there. And we'll also have in the meditation downloads and the recording access post the program is over. And during these 3-4 days, you will have opportunity to interact with both these experts, ask your questions, any of the aspects which you are facing, and can be addressed. So now moving on to the how to the schedule of the program. So Charu, can you move to the next slide? Yeah. So this is the schedule as I shared. On 18th, you'll have more deeper aspect of the physiology, the practices to restore hormonal balances, and practices on the stress and the gain control over the thoughts and emotions. So she'll work on the first aspect, the mind part, and the bliss part there, and the intellectual part. And day two, as I shared, that Charu will be covering dietary strategies, appetite control, meal frequency, introduction to seed cycling for PCOS, which is very important. And then on 20th of December, the practical yoga sessions, which will be taken up by Nidhi. Now, how to register for the program? The program price, right now we're having an early bird offer for, we still have 10 to 12 seats left for the early bird offer. And you can make the payment directly through the Paytm or GPay link. This is the number. Or you please do send the screenshot on the same number once you have paid, because it doesn't capture the email address and we don't get the complete phone number, so that we can include you in the program. And or you can scan this scan code. I'll also be putting up the Razorpay link in the chat section. So we do encourage that, it's rarely will get an opportunity to have expertise of nutrition and yoga with such experienced practitioners, and who can really help you to at least open up the door into holistic healing, in addition to whatever prescriptions and other things you may be following. So now I will take up the questions, and I'll request on Nidhi or Charu to answer these questions, and if they're program related questions, I'll also answer those. So the first question is, okay, I think this has been answered, that PCOD and PCOS are different or same. So I think Nidhi started with that, but Nidhi, can you quickly mention the difference once again?
Basically, both are the same condition. It is just two names given to it. You can, according to medical science, the more ideal term for the whole disease is PCOS, because it's a syndrome, it's a collection of multiple disorders. So the more ideal term to use is PCOS. While I would also like to make a point that there is one more term to add to the confusion, is PCO, polycystic ovaries, which is what you will usually see in the ultrasound reports. So when you see only the ultrasound report and you see PCO, that means it's talking only about the cyst in the ovaries. Added to that, you do a blood profile, blood test done, your metabolic conditions diagnosed. If you club all of them together, then it should be ideally called PCOS.
Thanks. Now, Charu, can you still project the screen for the registration in the meanwhile? Yeah,
Yeah, sure, I'll do that.
Yeah. Next question is taking medication compulsory? Yeah, Nidhi or Charu, you can, either of them or both of you can answer.
So compulsory, I don't think so it is compulsory. Yes, based on certain complications, based on the individual. Sometimes for immediate relief, medications are good, but for long term lifestyle changes are better, because you cannot rely on the chemicals for your whole life, and any medication you are taking, it is having a side effect on your body. So that's unavoidable. You can take it for emergency, for immediate relief, and that might be necessary at some time.
Yeah, yeah. So I think, as I mentioned that when it comes to medication, yes, when you are in the medication, it will require you to just take some guidance from your doctor, as your symptoms and your condition improve, to taper it off. That would be good, because hormonal any medication have a long-term side effect for sure, and we all know that medicine is only managing the condition but not curing it. So unless until you address the root cause through nutrition, sleep, and lifestyle change, you can't expect to go off the medication. So important would be to take those steps, and yes, you can be, medicine free. So Nidhi or Charu, can you share any of the experiences you have with the people who have your work that they've been able to free from their medication?
Yeah.
Yes.
There are many who have actually left their medication, and in India, somehow the concept is that the first person to reach when you have such a situation is the doctor, and that's when you are referred to a dietitian or to a yoga expert from there. So whenever a person comes to us, he or she is mostly always on medicines first, and they often don't start with the lifestyle change as the first choice of treatment. And and once the doctor tells them to start a lifestyle change, maybe they get more confidence into this whole thing and they start believing in this concept. But yeah, a lot of young girls and a lot of women who are trying to conceive but were not able to conceive have been able to conceive and have been taken off completely from their medications. And there were girls who were not able to have their periods regularly or were taking oral contraceptives for the same, have now been able, they've completely left medicines and they're feeling much better than before.
Great,
So
great.
many such cases, yeah.
Now, and I think, based on, some of our past programs also, we have found that that people start to experience, the benefits, whether it can be improved energy, better mental, makeup, as well as, weight loss. So these are the things which you start to experience in, first few months also, once you start on the, program. So yes, it depends on case to case basis to degree of which, and you have the condition, and also how much effort you are able to put in. But the consistent experience have been that people who consistently follow lifestyle change, nutrition, and yoga, they do start experiencing the benefits and the symptoms, which they're facing. So that is very much important.
Yeah.
Next question is, although I'd answered this, but will this program focus on obese PCOS women only?
No, no, not nothing like that.
Okay,
We're going to offer as customized help as possible. So lean
okay,
or obese doesn't really matter.
okay, sure. Next question is, what is the reason of prolonged periods? I have my monthly cycle for almost 10, 11 days. Uh, so, Nidhi or Charu, can you answer this question?
We'll have to look into individual
Okay,
reports and medical tests
There
to
can be
find out why,
many
because it
reasons.
could
Yeah,
be many things.
there can be
okay.
many reasons, and I also believe that it is actually the doctor's area of expertise to make a diagnosis. A
Hmm,
dietitian or a yoga expert is not the right person to be making a diagnosis as to why a certain thing is happening.
Yeah.
hmm.
Once we have a diagnosis, we can help you with a program to get better with it, but not making a diagnosis.
Yes.
Sure. And I think the next question will be, answer will be similar. Then what is the reason for short monthly cycle? So yeah, same answer, which is applicable to the earlier question. The next question is it difficult to conceive if I have PCOS? And also, yeah, so on the conception part, why it happens, I think you mentioned it, Nidhi. If you can want to elaborate on
Because
that.
of the irregular cycles, you doesn't know when the ovulation actually is taking place. So it's very difficult, and the eggs are turning into the cyst, so it becomes difficult to conceive. Almost 75% of the women suffer with infertility. This is the largest group of women who go for IVF and IUI treatments.
Oh, okay, okay. Now the next question is that, Miss Hindu Chobe has asked that I have PCOD for 6 years and I have a lot of problems, and my weight is 120 kgs, and I also have problem with my knee ligament. So how, I think she wants to know how this program or how information we shared in this program can help her on this.
So she need to lose weight, and that's the cause for her knee issues. Is she has 120 kgs of body weight, and one big misconception in the field of yoga people have is only if I can bend upside down, then I can do yoga, but that's not true. And even for people who can do limited movements, even with back pains, knee pains, neck pains, there are specific practices which you can do and which will eventually going to help you come out of those issues and will slowly help you to reduce your body weight. So for all these things, there are practices and we can take care of them.
Sure. Next question is that have you mentioned four pieces of a puzzle wherein one part was medicines? Please clarify. So I think what Charu meant by the four pieces of a puzzle, that obviously who have people who have PCOS right, now most of them are taking some form of medication. So that is an ongoing thing which is happening. But obviously we need to get overcome that condition. And if you are not focusing on other three aspects, then the medicine dosage will keep only increasing, and you will remain in the vicious cycle. You will not be able to come out of it. So that's what she meant, that it is the other three pieces which the focus needs to be put in with the same intent
Yeah.
and
So
focus.
I'll also put in a little bit here. What I wanted to say here is that, like Nidhi explained, that your first medicine you put on is metformin. Metformin is given to you for improving your insulin sensitivity. And, if you're eating a diet that's reducing your insulin sensitivity, and then you're taking a medicine that's improving, so you're actually not doing any good to you. So you have to make sure that if your doctors put you on some medicine, you do the right exercise and the right diet to help that medicine work better. So slowly you can stop the medicine, and just the lifestyle can help you, take over the problem on its own. So definitely, those medicines are a part of the puzzle, but just taking the medicine and ignoring the other three things will not help at all.
Thanks, Charu.
Yeah.
Next question is that okay, so I think, yeah, we've answered that in terms of the periods, happening in the cycles of, period. So I think, we've already exceeded, our timeline, and we've answered all the questions. And as I shared that the program is open for everyone to come and register, and we're trying to have a limited, good batch so that we can give qualitatively deliver the content, and this price will be valid for a few more days. And I have shared the Razorpay link again in the chat. We'll also be emailing this link, and also you can make the payment via GPay or scan the code which is there. So whenever you make a payment through GPay or Paytm, do send a screenshot on the same number, which is 99106 07815. So if anyone has any questions related to program, I'll quickly take it up, or then we'll end the session today in a minute's time. So in the meanwhile, I'll just do a quick summary. I think it has been quite an enlightening session wherein Nidhi started with explaining in what is the problem, and how it, for me, the eye-opening aspect was how this condition ignored in the early phases can lead to really serious problems, ranging from infertility to diabetes to even, cancer in few cases. So, and it being a problem at the endocrine system level, it can not be completely cured through medication, or maybe even, some any surgical intervention. Only way out is through changes through the jigsaw puzzle which Charu spoke about, which is nutrition, uh, physical well-being, as well as the sleep and the mental well-being. and without covering those, which is why this program is all about, to have both experts, with us to guide through us how to take these steps. Now you know the background that it is important, but now in the program and the workshop will be covering that how we have to specifically to take these steps. And as both of them shared that we have success happening with people who have taken up these changes, and I'm sure your doctor would be supportive of your action. That's very important, that this is not in terms of it against the medication, but it's that how you can come out of it. And I'm sure that's the intention for all of us. So we look forward for you all joining the program. And program starts on 18th of December. And please register fast to avail the early bird offer. And we'll then get you into the program. Thank you, Nidhi. Thank you, Charu, for your time. And I think,
Thank you.
yeah, thank you.
Thank
Thanks.
you.
Bye.